Good to go.
Lovely.
Okay. Well, good morning. We're here today for our update of COVID-19 across the Murrumbidgee Local Health District region. So really good news for our region today. Our numbers remain at no new cases, and there are 54 cases to date where people have been infected with COVID-19 across our region. Happily, 44 of those people have now recovered, but we still have 9 active cases, and sadly one person, we must remember, has lost their life during this pandemic in our region. The testing results for people in our region are outstanding, and I do want to thank everybody across our region for coming forward and being tested. Testing is the way that we can keep you safe. If we get onto a case early, it means they can go in isolation and we reduce that risk of community transmission. So really brilliant numbers. We have tested nearly 48,000 people across our region to date. And we are testing in collaboration with a number of partners now. And we've seen the numbers at our Wagga Wagga and Griffith locations nearly double in the last couple of weeks. So people are being responsible, they're coming forward. Our partners in testing are the Commonwealth Government funded fever clinics. Also some of our private pathology companies are testing now, GPs, and also our hospitals have got testing clinics. So it's a really great result. Don't forget our little van though, our little van that travels around to the rural regions and makes sure that everybody, no matter where you live, has an opportunity to come forward for testing. One of those vans at the moment is situated at Lavington, where we perceive that there is still quite a high risk in that community. And also one of our partners has taken over the testing at the Albury Showground. We've seen that really great increase in numbers in Albury for testing, and also in the Griffith region as well as Wagga Wagga. I wanted to talk today about how we're working to keep people in our residential aged care facilities safe. So we've all been watching the news and the media, and we know that people who live in a residential aged care facility are one of our highest, most vulnerable population groups. Sadly, in Victoria, we've seen 161 residential aged care facilities with infections, and sadly, 280 people have lost their lives. So our job now is to work collaboratively with with publicly funded aged care facilities to have really strong plans in case we get an outbreak in our region. There are 89 residential aged care facilities across the Murrumbidgee region. That's a lot. We're a big aged care provider. We've got an ageing population in our region. We operate 20 of those ourselves by the Murrumbidgee Local Health District, but there are 14 aged care facilities, for example, in Albury alone. And there are 55 other residential aged care facilities spread across the Murrumbidgee footprint. With each and every one of those partners, we have come together on what we call a community of practice. We are focusing on preparation together. Every single provider has come forward to join with us in that collaboration. It's all about being prepared. So the Health District is ensuring that infection control protocols and staff training are in place in each of those facilities, including our own, that they have good outbreak management plans, and that they have good stockpiles of PPE in case there is an infected patient in their facility. We're also doing a range of scenario testing to make sure our plans are robust, and that's also really important. We're creating sector outbreak response teams so that if there's more than one outbreak in a facility, that we can send the expertise in to react quickly and get on top of any potential risk of transmission into our community. We're also working with those providers on workforce. Being a rural region, workforce is one of our biggest risks. And we've seen in Victoria how we can expect approximately 50% of the workforce to be either infected or affected and not come to work. So we have to have alternative plans about how we're going to step in and provide that additional workforce into a residential aged care facility. We've got an IT platform where we share resources, and I'm really proud of the work that we're also doing in partnership with the Primary Health Network, the Murrumbidgee Primary Health Network, who are our partner in this work. So for all the people in the region, I want to thank you also for abiding by the restrictions that we have in each of those residential aged care facilities. If we ever even get a sniff of an outbreak, we'll be locking down those facilities. But at the moment, we have restricted visitation, and people who go into residential aged care facilities are asked to wear a mask, and they must also have flu vaccination. So thank you for your patience. It is really important that we keep contact with those residents, but we also need to keep them safe.
Jill Ludford, just on the staffing you mentioned with the aged care facilities, what is the action plan if, I guess, a case is recorded at an aged care facility and staff aren't able to come to work? Do you have locums on standby ready to come in? How does that work logistically?
So the workforce surge plan is quite complex. We've got to remember that we've got private hospital in our region, we've got affiliated aged care facilities in our region, we've got a casual workforce, but it's also for the local health district. It's about what can we stop doing so that we can actually then provide the workforce into those facilities. We're working on our workforce surge plan also with the Albury Base Hospital, who are part of Albury Wodonga Health, which is also really important. Yeah.
What about staff that live and work in that border bubble region and might be travelling back and forth and facing quarantine, you know, when they're going to work and coming back across the border? Is there any sort of movement on assisting those staff that may be affected by that current situation?
So we'll talk about the Albury-Wodonga border closure next, because there is no doubt that that border closure is impacting communities and individuals. People are separated from families, businesses are impacted, also health and education workforce are impacted. So we have 280 staff who live in the Victorian region, and out of those we've worked through that approximately 80% of them are actually critical frontline workers. So 60 are able to work from home, and all the remaining staff have been given exemptions and or permits, depending on where they live, whether in the border zone or whether they're outside, to permit them to come to work. The conditions are very strict, however, and they must abide by them. So they can only drive from Victoria to their workplace. They have to abide by the social distancing and the safety requirements, and then they may only drive home. They cannot go anywhere else in New South Wales. So that has meant that together with Albury Wodonga Health, we have been able to maintain our critical workforce for that border area, and it's really important. But I just do want to say to people across on the border region, this is hurting many people, and we do know that people are feeling distressed. And social contact, sticking to that regular routine and reaching out and asking for help early are proven indicators of improving your well-being. So I really encourage people to talk about how you're feeling. It's tough, it's tricky. Some people are not being able to connect with their family, and now with the time frames blowing out, that might not be able to see their families for Christmas. So that's really tough for people. We have got additional mental health and wellbeing support staff along the border areas to make sure that we can provide that additional support for people. And finally, I just want to touch on our workforce as we've been talking about them again. We are maintaining our hospitals to be ready in case we do get an outbreak, such as what we have seen in some of those Melbourne hospitals. We have been able to maintain our ability to scale up our intensive care beds. We've got new ventilators. But I want you to think about your healthcare workers for just a moment. Every time they come to work, every day, every patient who comes in who has got any sign of a respiratory symptom, they have to wear full PPE. And over a long period of time, that is really, really critical for the safety of patients and staff as well. But it's also tiring, and our workforce are tired. So give them a smile next time you see them. We have additional support and wellbeing programs and psychologists to help them, but we're also encouraging people to take leave. It's really important that people are rested and that they are motivated to continue that PPE, donning and doffing, and making sure they get it right absolutely every time. We've got these rotating teams called Murrumbidgee M teams, and they cycle through our facilities making sure that culture and morale is high, but also testing to make sure that people are putting on their masks and their goggles and their gowns correctly, and that through fatigue and the monotony of doing it every day, that they haven't fallen into bad habits. So support your healthcare worker, give them a smile next time you see them. They're doing an absolutely awesome job. Now today I've got a colleague here from New South Wales Pathology. There's some good news for people who are coming forward for testing in our region. One of the things about testing is when you've had your swab, you have to go into isolation until you get your results. And there's some really good news here today about the turnaround times and also the SMS testing program that we have so you can get your results on your mobile phone. So I've got Anthony Flaskas here to talk to you today about our pathology testing, which is done locally here in Wagga Wagga. Anthony, over to you.
Thanks,